Hello everyone, this is Albert. I am going over Medicare prescription drug coverage Part D, and the topic of this video is how do other insurance and programs work with Part D? It's a very important question for many people out there. If you would please get out your Medicare and You book, the 2020 edition, please get it out, and let's turn to page 81 and let us begin. How do other insurance and programs work with Part D? Medicaid. If you have Medicare and full Medicaid coverage, Medicare covers your Part D prescription drugs. Medicaid may still cover some drugs that Medicare does not cover. Employer or union health coverage. If this is you, let's follow along. This is health coverage from your spouses or other family members' current or former employer or union. If you have prescription drug coverage based on your current or previous employment, your employer or union will notify you each year to keep letting you know if your prescription drug coverage is credible. Keep the information you get. Call your benefits administrator for more information before making any changes to your coverage. Note, if you join a Medicare Advantage plan, you, your spouse, or your dependents may lose your employer or union health care coverage. That's important. COBRA. This is a federal law that may allow you to temporarily keep employer or union health care coverage after the employment ends or after you lose coverage as a dependent of the covered employee. As explained on page 18, there may be reasons why you should take Part B instead of or in addition to COBRA coverage. However, if you take COBRA and it includes credible prescription drug coverage, you'll have a special enrollment period to join a Medicare drug plan without paying a penalty when the COBRA coverage ends. Talk with your state health insurance assistance program, SHIP, to see if COBRA is a good choice for you. See pages 109 through 112 for the phone number. The next insurance program Medicare is going to talk about is Medicare Supplement Insurance, Medigap insurance policy with prescription drug coverage. You may choose to join a Medicare drug plan because most Medigap drug coverage isn't credible, and you may pay more if you join a drug plan later. See page 77 through 78. Medigap policies can no longer be sold without prescription drug coverage, but if you have drug coverage under a current Medigap policy, you can keep it. If you join a Medicare prescription drug plan, tell your Medigap insurance company so they can remove the drug plan. Tell your Medigap insurance company so they can remove your prescription drug coverage under your Medigap policy and adjust your premiums. Call your Medigap insurance company for more information. Note, keep any credible prescription drug coverage information you get from your plan. You may need it if you decide to join a Medicare drug plan later. Don't send credible coverage letters or certificates to Medicare. Going on. How does government insurance work with Part D? If this is you, please follow along. The types of insurance listed below are all considered credible prescription drug coverage, and in most cases, it will be to your advantage to keep this coverage if you have it. So Medicare is saying if you have one of these listed, you need to keep it. The first one is Federal Employee Health Benefits, the FEHB program. This is health care coverage for current and retired federal employees and covered family members. FEHB plans usually include prescription drug coverage, so you don't need to join a Medicare drug plan. However, if you do decide to join a Medicare drug plan, you can keep your federal employee health benefits plan. And in most cases, the Medicare plan will pay first. For more information, visit opm.gov/healthcare-insurance/healthcare or call the Office of Personnel Management at 1-888-767-6738. If you're an active federal employee, contact your benefits officer. Visit apps.opm.gov/ABO for a list of benefit officers. You can also call your plan if you have questions. If you're a veteran benefits, please follow along. This is health coverage for veterans and people who have served in the U.S. military. You may be able to get prescription drug coverage through the U.S. Department of Veteran Affairs VA program. You may also join a Medicare prescription drug plan, but if you do, you can't use both types of coverage for the same prescription at the same time. For more information, visit va.gov or call the VA at 1-800-827-1000. Now, if you're TRICARE Military Health Benefits, this is a health care plan for active duty service members, military retirees, and their families. Most people with TRICARE who are entitled to Part A must have Part B to keep TRICARE prescription drug benefits. If you have TRICARE, you don't need to join a Medicare prescription drug plan. However, if you do, your Medicare prescription drug plan pays first and TRICARE pays second. If you join a Medicare Advantage plan with prescription drug coverage, your Medicare Advantage plan and TRICARE may coordinate their benefits if your Medicare Advantage plan network pharmacy is also a TRICARE network pharmacy. Otherwise, you can file your own claim to get paid back for your out-of-pocket expenses. For more information, visit tricare.mil or call the TRICARE Pharmacy Program at 1-877-363-1303. Last but not least, if you have Indian Health Services, IHS. The IHS is the primary health care provider to the American Indian Alaska Native Medicare population. The Indian healthcare population, consisting of tribal, urban, and federally operated IHS health programs, delivers a spectrum of clinical and preventative health services throughout a network of hospitals, clinics, and other entities. Many Indian health facilities participate in the Medicare prescription drug program. If you get prescription drugs through an Indian health facility, you'll continue to get drugs at no cost to you, and your coverage won't be interrupted. Joining a Medicare drug plan may help your Indian health facility because a drug plan pays the Indian health facility for the cost of your prescriptions. Talk to your local Indian health benefits coordinator who can help you choose a plan that meets your needs and tell you how Medicare works with the Indian healthcare system. Note, if you're getting care through the IHS or tribal health facility or program without being charged, you can continue to do so for some or all of your care. Getting Medicare doesn't affect your ability to get services through the IHS and tribal health services. That concludes this portion for Part D. How do other insurance and programs work with Part D? Thank you so much for your time. Have a beautiful day.